Hi, welcome to Iron's Health Talk with Dr. Akram. I am Akram. In this program, we'll be talking about all kind of different health issues with different experts in the field. Today, we will be talking about peripheral vascular disease. So sit back, relax, enjoy your time with us. Vascular disease is a class of disease of the blood vessels, the arteries and veins of the circulatory system of the body. Disorders in this vast network of blood vessels can cause a range of health problems which can be severe or prove fatal. Peripheral artery disease refers to disease of the arterial blood vessels located outside the heart and brain. They are most often caused by buildup of fatty deposits in the arteries. Peripheral artery disease is a major cardiovascular disease that affects 200 million people worldwide every year. An estimated 8.5 million people in the United States have peripheral artery disease, affecting approximately 12 to 20% of Americans over the age of 60. Peripheral vascular disease affects 20% of the UK population between the ages of 55 and 75. Experts say that around half of all people with peripheral vascular disease do not know they have the conditions. This is because many individuals have no symptoms. This is a big topic to cover in 1 hour. Therefore, we have chosen two most important conditions for our show today. They are varicose veins and aortic aneurysms. So, let's look at the symptoms, signs, prevention of these conditions, and also look at the diagnosis and the remedies we have in store. Let's welcome our special guests on the show. Mr. Ahmed Abidia and Mr. Daniel Dobes. They both work as consultant vascular surgeons in NHS in Essex, UK. Welcome to our show.
Good evening.
How is your day?
It was fine, thanks.
Very good. Thanks for inviting us, Akram.
Excellent. So, what you guys been doing today?
Yeah, we were busy with routine vascular surgeries every day. Yeah.
Have you been working today?
Yeah, despite of critical part of coronavirus, we are still working, still doing care of our patients.
Excellent, excellent, excellent. Okay, let's see what we're talking about. Can you, Ahmed, can you tell a little bit about vascular disease and what it is about?
Thanks, Akram. As you mentioned in your introduction, vascular disease encompasses the arterial disease and the venous disease. The arteries, just to go with your viewers to basic biology, the arteries are the blood vessels that carry the blood from the heart to the rest of the circulation. And if you look at the model there, are the blood vessels in red. They carry the oxygen and the nutrients to the tissues. And the veins carry the blood back from the tissues back to the heart. And the disease of the arteries and the veins are different. The arteries' commonest problem is arising from them being lined with cholesterol and fatty streaks, and that narrows the blood vessels and causes what in layman term is known as hardening of the arteries, or medically atherosclerosis. That causes things like high blood pressure, hypertension, and when the arteries are narrowed significantly, they can cause problems in the various parts of the body. So if it's the brain, it can cause a stroke. If it's the heart, it can cause a heart attack. And when it happens in the legs, it can cause gangrene. So it's all serious, very serious conditions that happen. There's also the possibility of the arteries becoming weak and becoming aneurysmal, and that's what we're going to talk in the later on in this subject. The veins disease are slightly different. The superficial veins, they can become varicose veins, which is, again, we're going to talk about this in this show. While with the deeper veins, they can be more serious. You can develop clots, which are well known as deep vein thrombosis. And those are clots that can travel to the lungs and cause fatal problems known as pulmonary embolism.
Pulmonary embolism, that's right.
So
is it the same thing with the stroke as well? Is it? Can they get stroke?
The stroke is more in the arteries. So if you look at the red vessels, those are the ones that carry the blood to the brain up, and if they get blocked, they can cause a stroke.
Okay.
While the clot in the veins, if it travels to the lungs, then it causes the pulmonary embolus. Both very serious conditions, and it's very important that we understand the disease and how we prevent them and how to treat them. And there's been massive advances in science in understanding the basic pathology and how it gets treated.
It gets treated. Okay, guys. This is a live program, so call us on 0203 515 5788 if you have any questions or suggestions, or write to us healthtalk@intv.co.uk, and you can also follow us on Twitter, Facebook, Iron Health Talk with Dr. Akram, and of course you can watch us on Facebook Live, intv.co.uk. Okay, let's look at a special video we have prepared.
Varicose veins are the unsightly and sometimes painful bulging vessels usually found in the lower extremities. To understand the cause of varicose veins, we first need to look at the structure of the vessels in our bodies. Whenever we look at a graphic representation of the circulatory system, the vessels in the body are labeled blue and red. The red vessels are the arteries, which are structurally optimized to carry the blood from the heart to the periphery of the body. The veins, on the other hand, are the blue vessels on a graphic picture of the circulatory system. The veins are designed to bring the deoxygenated blood from the periphery back to the heart for reoxygenation. Because we walk upright, the heart would have a hard time pushing the blood down to the toes, through the small capillaries, and back up through the veins if all these vessels were simple tubes in the body. The veins, therefore, are valved to keep the blood flowing in the right direction. As the blood surges through the veins back towards the heart, these valves open and allow the blood to pass. When the flow stops and reverses, the valves will close to prevent the blood from falling back to the feet, sort of like a series of locks on a river. Muscle pump complex and acts like an auxiliary heart or pump in the legs. Capacitance system, meaning that they can hold a lot of blood and simply dilate up to accommodate the extra volume. If you lock your knees and deactivate the calf muscle pump complex, blood will pool in the lower extremities until there is insufficient volume to pump to the brain, and dilate up as the weakened wall stretches. This pulls the valve leaflets apart, allowing the blood to reverse direction, developing a column of blood on the next intact or competent valve. Over time, this valve will eventually fail, and the cycle continues until the vein becomes completely incompetent with no intact valvular system. The body then has to find an alternate way to drain the blood from this incompetent vein, so these tortuous vessels right under the skin surface dilate up and become the painful and unsightly varicosities that develop on the legs.
Daniel, you must be seeing lots of patients with varicose veins in your practice, and you work as a vascular surgeon in Essex. How long have you been working as a vascular surgeon?
Yeah, it's all the history looks like it's 22 years.
22 years you've been working as vascular. That's amazing. That's amazing. Excellent. So can you tell us a little bit about these varicose veins?
Yeah, the typical example is that a young lady come to vascular clinic, and she's complaining on long-term job on her feet as a hair stylist or nurse.
So people who are standing all the time, most of the time?
Yeah, mostly standing position without any walking, and complaining of heavy legs, dilated veins, and mostly her mother had similar symptoms. And we call this picture as a primary varicose veins, but we have a so-called secondary source of problems, which could be due to previous injury or heart disease or obesity, and these problems are with the same symptoms due to high venous pressure.
High venous pressure. So it's like the pressure in the heart is kind of, it can't reach to the heart, or so it's pulling down.
Yeah, it's very common if people have swollen legs due to heart disorder, that the heart is not working as a pump. Then the blood is waiting or causing distension.
So it backflows, isn't it?
Yeah, there's
the
problems with drainage
Yeah.
from leg due to heart which is not working properly as a pump.
Yeah, I think it look like it's normal in a pipe, isn't it? If you have water coming down, and if you don't have pumping mechanism to put it up.
Yeah, it has
And the
physical
water will
principles
sink
that are
down,
working.
so
Yeah, it's the same if patients are active with walking. Muscle helps, as we saw the video, are helping with the drainage of the blood coming back from
That was
legs
quite
to
good.
heart.
In the video, they were showing those valves, and they're pushing down, and they
Then there's a main problem is the valves, because when the vein is enlarged, causing the dilatation and problems which can lead from small cosmetic things up to like ulcer, which are difficult for healing.
So what are the risk factors, Ahmed?
The main risk factor is genetic, is how you're born. So if you got the genes and you're meant to develop varicose veins, unfortunately there's a very high chance that you would develop varicose veins. It's a very common problem, and as Daniel alluded to, it affects about 1/3 of the population at some point during their lives.
1/3 of the population?
That's huge. It's a huge number,
big,
yeah, to a varying extent. The people most affected by this would be ladies, and the risk factor that comes is the pregnancy. The pregnant uterus presses on the pelvic veins, and that transmits to the legs, and then the patients develop varicose veins.
So during pregnancy, that's I've seen as well.
So
it's quite common. So.
It's a very common risk factor among patients who had varicose veins. That it's following pregnancies that they
after
develop
delivery.
them.
Does the varicose vein stays or it disappears?
In a significant proportion of ladies, they may regress but not disappear completely.
Not disappear.
And in some, they will remain and continue to cause symptoms. Similar to what Daniel mentioned, the ache is the discomfort, the heaviness, and swelling sometimes.
Swelling sometimes. What are the common signs and symptoms, Daniel?
Yeah, as we mentioned from the beginning, there's a aching leg with, I feel the leg as heavy, with throbbing pain and tired and night cramps.
Cramps as well, okay.
And the main area is around ankle, especially internal ankle is this typical area with such as skin changes. Initially can be cosmetic issue only with so-called spider
people
veins.
come especially for the cosmetic issue as well, isn't it?
Yeah, it could be beginning, because if someone is young and needs to be attractive, which is I think the common sense, but then there are patients who are complaining of severe skin changes with the brown color and pigmentation.
Oh, the color changes as well with this.
And then the skin became to be stiff. We call it lipodermatosclerosis. And it can be some small skin changes which can lead for open lesion as ulcers. And the healing process then is very difficult, because we have a patient with additional comorbidities. And it's important to clarify there's a problem involving veins, but sometimes it can be a mixture of artery disease together. Together with the heart comorbidities, then it's very difficult to heal it completely.
Okay. We talked about, can we prevent this? This exercise or something helps, Ahmed, anyway?
The exercise is good. For health generally. It doesn't cure varicose veins, and it doesn't prevent varicose veins. But exercise comes in minimizing the impact of varicose veins on the legs. If you remember the video that we saw earlier, there's a calf pump that pumps the blood backwards towards the heart, and exercise uses that calf pump to pump the blood back to the heart and passing back the waste products, which are the cause of the aches and the discomfort that patients have when they have varicose veins. So light to moderate exercise can improve the symptoms.
Can improve the symptoms.
Can improve the symptoms, but would not cure the problem, would not prevent the veins from developing, and will not make the veins disappear. Another thing that could help is losing weight.
Losing weight.
Yeah, and that can help prevent varicose veins from developing at the beginning, and can minimize the symptoms coming from the varicose veins. Unfortunately, it doesn't make the veins disappear. If anything, sometimes losing weight makes the veins more prominent and visible. But in terms of symptomatic improvement, there's benefit from both exercise, mild to moderate exercise, and losing weight.
So there's look like there's, apart from exercise, there's anything else to prevent, or can they advise anyone? Are there anything else they could do? Like if your parents had varicose veins, how would you advise the children? How can they prevent it?
I think, like I mentioned earlier, if genetically you were meant to develop varicose veins, then as you exposed to the risk factors, like a pregnancy for ladies, being overweight or lack of exercise, they can develop. So preventing would be difficult if you have the genes for the varicose veins. There are medical measures like wearing compression stockings.
Compression stockings. I was about to ask about that. Yeah.
They might not be a practical preventing measure because they're not the easiest to wear if you don't have varicose veins, just to prevent them.
Just to prevent it.
So from a practical point of view, you wouldn't recommend people to wear them just for prevention.
But if someone has varicose veins already, will it be beneficial for them to wear compression stockings?
Certainly. If somebody has varicose veins which are causing problems, and they're not considering surgical treatment, then compression stockings would be an ideal way to manage the varicose veins and control the symptoms.
Okay. Sorry, can you say a little bit about the medical management?
The 2 points I mentioned earlier would be a part of the medical management, like losing weight and mild to moderate exercise.
There's no special tablet you drink it and your varicose veins disappears.
There are available commercially available tablets that you can use to manage varicose veins. The famous one is the red vine leaf extract. That's commercially available as under the name Antistax. It's a herbal remedy.
It's a herbal remedy.
Yeah,
right.
and it's available in the shops without prescription. There's no clinical evidence to support that they make a difference. There are low quality studies which have shown that they can make a difference, particularly to the symptoms of the patients and the swelling of the legs. And I've seen many patients who reported back to me that they've benefited from the herbal medicines. However, like I mentioned, there is no scientific high-quality evidence to support their routine use. So in the NICE guidance, which is what we follow in medical practice, there's no mention of the herbal medicine as part of the treatment.
Okay, even though it's not mentioned in the medical books, but in your experience, people who had taken this tablet, how do you call it again?
Antistax.
Antistax.
And that's the commercial name. It's red vine leaf extract.
It's a red vine leaf extract, so that works.
It may work. It may work for some.
Okay. Oh, okay. Let's play another video and see how we can treat this surgically. Let's wait for the video. What's happening there?
Yeah, that's showing the treatment from inside the vein. There is a catheter with heating the vein from inside, which is minimally invasive and efficient when we compare previous old-fashioned stripping. And you can see the catheter that burning the segment of vein, and there is a local anesthetics. You can see the compression to have a good contact with the probe inside, which is doing the occlusion, which it means to stop the flow in the vein. and there's the detail of the catheter which is removed from the vein and after successful treatment. Special form which sealing the small veins.
Okay, Daniel, let's talk a little bit in more detail about. So we have shown in the video that about 3 kind of different surgical management for this this condition, in sense of varicose veins. Can you say again in more detail one by one?
Yeah, I think what is same for these 3 techniques is that they are minimally invasive. It means that recovery is fast, and to soft tissue injury, when we compare the previous stripping, is better because we can have a good dose of the energy to heat the vein from inside, instead of to remove it and to have a lot of bleeding and bruising. Of course, there are some side effects that patient can feel some sting inside, some throbbing sensation initially, but it's for 24 hours, and usually patient can be back to work after 1 or 2 weeks times easily, with good cosmetic outcome and treatment outcome too, because when we need to prevent ulcer, or if there was an ulcer, then it's a good option to have a good healing efficiency of this technique. And it's sometimes we have to combine these 2 techniques. For example, we will use the microwaves source to so-called radiofrequency ablation. It means the heating. It's like small microwave oven.
So you
inside.
pass this microwave probe through a vein, and you target the vein you want to ablate.
Yeah. And then we cause the heating from inside, and the collagen activity is to be squeezed a little bit.
Okay.
And then the vein is closed. And if you have some varicose veins which are suitable for foam sclerotherapy, we can combine these 2 types of treatment with good outcome at 1 session, and we have a good outcomes after daycare surgery only. It means patient can come 1 day and the same day can go home.
They can go home.
Have some rest time, to some basic painkillers for the night time, and next day can start to walk a little bit. But we always recommend to be careful with a lot of walking, not due to severe complications, but to keep the efficiency of the technique.
I think it's important to highlight that these are all minimally invasive procedures, replacing what many viewers will remember, the old style treatment where veins used to be physically stripped.
So you don't that stripping, isn't it?
So
you
this
put that
stripping
metal
has
thing.
become very much historical, procedures. It's been replaced by the minimally invasive procedures, which Daniel mentioned, and the patient's left with almost invisible scars.
So the invisible scars, so it's good in
very
aesthetic
tiny,
as
very
well.
tiny. So aesthetically, they're much superior to the old stripping that used to be done.
So do you say, Daniel, after this surgery, our ladies can walk with their mini skirts?
Yeah, they can be modeled back easily. I can say.
That sounds good.
And
Sorry.
you saw the video, there is no cut, just puncture, which is good
Yeah.
advantage. And if they are with good compliance and good exercising, and they come in time too, that varicose veins are not too dilated, we don't have such a severe skin changes. Outcomes are cosmetically very good too.
Oh, so sorry for interrupting, Ahmed. Please continue.
I'm finished.
You're finished. Okay, guys. Today we are talking about vascular disease, and for first half we talked about varicose veins. We talked about pretty much about everything about it, the etiology, how it comes, and what kind of remedies we have. And we have two specialists in our studio. This is Daniel and Ahmed. They both are vascular surgeons. They work in Essex. And of course, I have my Iron Man first time in. He's my co-presenter today. And we're going to go for a quick short break, and we'll see you back shortly.